to all listening right now, vaccination is very important. Let's always remember that vaccination saves lives. It has keep many children from getting sick of different vaccine preventable diseases. So we would like to invite everyone, if your kids have not been given yet their vaccines, the Department of Health through the National Immunization Program provides you with free vaccines in your health center. Okay, I am Dr. 𝗀𝗃𝗀𝗀𝗀, the Program Manager of the National Immunization Program of the Department of Health. So there are three important reasons why children need to get vaccinated. First, because vaccination saves lives of children. It prevents serious illnesses and it averts hospitalization. Second, vaccination keeps them away from sick days. And lastly, vaccinated children also protect their friends and other children who are not yet immunized. So all of these reasons show the benefits of vaccination to the child, their friends, and family. They are allowed to develop and grow lesser risk of getting very sick or dying from vaccine-preventable diseases such as measles, polio, pneumonia, and many more. And through herd immunity, children can also share the same protection to the other kids that cannot get vaccinated and further prevent the spread of vaccine-preventable diseases in their community. Well, yeah, basically all childhood vaccines are generally safe for children. It has been extensively studied globally for several decades now, and its administration, including formulations for children, underwent rigorous expert evaluation before putting it out for public use. So vaccines are generally safe to everyone. Yeah, as mentioned earlier, all vaccines underwent extensive studies globally for several decades now, and the vaccines offered by the Department of Health has been there for several decades and has been studied globally for a lot of years now. So it is then very safe and effective. The vaccines, not just by the Department of Health, but the other vaccines being offered and have approval from the Food and Drug Administration. So the vaccines ensure that age-appropriate doses, formulation, and type of vaccines are given to children. And given this, there may be differences in the doses or formulations given to various age groups. So it may contain the same specific serotype for children, but the doses or some formulations may differ based on the age specific groups. So a child is evaluated before the vaccination person for any mild or severe illnesses or any history of allergies to vaccines and other vaccine components. So it's basically the same screening process as you do with other vaccines and other drugs. So they may be cleared for vaccination if they have or they have a mild illnesses such as temperature not exceeding 38.5 degrees Celsius. And of course, there will be no allergies to any vaccines or vaccine components. So if they have severe or critical illness, they have allergies to vaccines and other vaccine components, then they will not be cleared to receive the vaccine. So parents should make sure that the child or their children get enough rest before the vaccination. So they should also practice pacifying their child and keep them in a non-stressful environment during the vaccination schedule. So they are advised to seek the guidance of the barangay healthcare workers or any of our healthcare providers in the facilities in their area for the appropriate scheduling of their child for vaccination in the center. And for private primary care providers, they may seek consultation with their private pediatricians or other healthcare providers. And if their child is to receive their succeeding doses of vaccines, parents should bring their child baby book or their vaccine record for the vaccines to be recorded given in that health facility, and for them to continue keeping them for succeeding vaccinations. Yes, a child can still receive his or her missed doses of vaccines. Immunization services provided by the DOH through the local health offices include routine and catch-up vaccination. So these are free and available for children 2 years old and below. So they just need to visit their nearest health center in their area to schedule them for routine and or catch-up immunization. To all listening right now, vaccination is very important. Let's always remember that vaccination saves lives. It has keep many children from getting sick of different vaccine preventable diseases. So we would like to invite everyone, if your kids have not been given yet their vaccines, the Department of Health through the National Immunization Program provides you with free vaccines in your health center, from protection against tuberculosis, pneumonia, measles, polio, tetanus, pertussis, diphtheria, and alike. So you can get them from your nearest health center, and or if you have the resources, you can get these vaccines and other vaccines for that matter in your private practitioners or private healthcare providers. Starting April of 2022, we will be launching the National Vaccination Day for catch-up immunization. First, providing or getting focused first on the provinces and highly urbanized cities with more than 10,000 unvaccinated children. So you can get this information from your healthcare centers if the province or your areas of residence are included. But this program, this campaign, will be continued for the next two months. So every last Thursdays and Fridays of April, May, and June. So starting May, it will be a nationwide campaign for our catch-up in order for those who missed their vaccines or their vaccination schedule to be provided with another chance for them to get their vaccination. For the past decade, the vaccination coverage of the routine immunization has been declining, and for the past year, year 2021, the recorded vaccination coverage among children is below 50%, and we cannot. One of the hard truths is that the COVID-19 vaccination and the routine vaccination share the same resources from our healthcare workers, from our logistics, and the commitment of different stakeholders. So we would like to call all of those who are interested, especially from our medical students, to join us in bringing back the coverage that can protect our children from various vaccine preventable diseases. You may contact the regional offices of the Department of Health or through the Association of Philippine Medical Colleges Student Network, so that the Department of Health will be coordinating closely with the APMC regarding the details of this National Vaccination Day for catch-up of routine immunization. And of course, we would like to invite everyone to advocate the benefits that we will be getting from having our children and all age groups with due vaccines through the routine vaccination.